Hey everyone, I'm way overdue for a video. I've been taking occasional recordings and just kind of trying to live life, and I fell behind on these. I do apologize for that, for anybody who's been interested in following my progress, anybody who's checked previous videos or anything like that. Not that I have this delusion that everybody in the world cares, but for those who do, this is an update. I really had intended to maybe put this right at 2 months. It's closer to 2.5 months now. I'm recording this on November 17th, and my surgery was September 4th, so 2 months and 13 days after. I do apologize. But I'm going to include some clips after this little kind of intro that just kind of gives a basic breakdown of how things have been going. And in each of those, I'm going to try to put just a label of roughly when it was this at 6 weeks or in the 7th week or what have you. And as I do that, you'll at least see some progression there. I'm going to put them in chronological order. So the last one in the video is going to be the most recent clip that I've got. But the exercises have been going well. The basic sort of situation is, or the basic, I guess, description is that everything in terms of my function, my capabilities, that's all bouncing back very nicely. The staff, particularly my own physical therapist, but the staff in general at the PT clinic seem to think that everything's going very well. Everything's on track. We haven't had any weird setbacks. I haven't had any major issues. The worst issue I've had so far is a little bit of swelling around the joint, but that's about it. All in all, doing very well. And that swelling really, it's just come up on really hard, really intense days where I'm doing a lot more work. If you want to see, we'll take a look here. This is how my knee is looking right now. So there is still, this kind of widening discoloration we're going to see here for a while. The actual incision is very small. The thinnest portion of the scar there, that is actually the width of the incision itself, maybe. And so anything wider than that, the rest of this is really just, stuff going on around it. Now you may notice my flexion, active flexion, is pretty good. It's not quite even with my other one, and I can passively bring it a little deeper. I'm not sitting on my knees just yet. I can't take that kind of pressure yet, but we'll get there. My extension, active extension, is pretty good. It's still short compared to my other leg, but it's doing okay. And I'm starting to slowly get a little bit of my medial quad back. As far as exercises, very quickly, they've progressed me into a few different things. For the last few weeks, they've had me doing Romanian deadlifts on one leg, so just standing on my surgical leg. And actually, when I'm weight bearing, my medial quad feels like it's coming in more. You may be actually able to see it had shriveled away. It's starting to come back some now. But anyway, doing this RDL thing, let me pivot out just a bit here, and just coming down and back up, and just being able to grip the floor and do these adjustments through my ankle, that's improved a lot. I still get fatigued pretty easily, but that's just going to come with time. And more recently, actually just yesterday at therapy, they had me start doing RDLs with both legs with a little bit more weight. Well, I wasn't doing any external weight at all before. It was just body weight. Just a small kettlebell, but working on hinging now, keeping both my legs kind of in tandem with each other, getting them to cooperate again, to work together, and just, doing these. I have started doing some squats. I was doing front squats, or goblet squats really, with a kettlebell, and I've gotten to the point where this is cold. I haven't warmed up, but I'm getting close to parallel. Is there pain here? Yes, but it's tolerable, and once I warm up into things are going better. It's more tolerable. I'm on the cycle. I think I have a little bit of footage I'll tack on. You'll be able to see a little bit of that, and that's now my warm up every day. Am I kicking somewhat? Yeah, I can do a little bit of this without too much difficulty. Now, standing on this leg and kicking with the other leg, I have to be a little slower and more careful. My pivoting is getting better, but I'm on carpet here, and this is difficult. So I kind of, if I'm doing it here, I do a couple pivots, right? But all in all, it's getting better. My walking is normal, and here's a big thing. I recently was approved to take off the big brace. So I'm now coming and going. This was just yesterday I was formally approved to do this. I'm coming and going without having to put anything on. I do still have a knee sleeve that I do, a couple of knee sleeves that I use sometimes just for a little extra pressure. Sometimes it reassures me. But in general, things are going really well. Let's see, what else? I'm also doing extension exercises off the side of the bed. So just basic stuff like this with blood flow restriction. So we're doing that for at least a couple more weeks. It kind of sucks. I'm not a big fan of it in terms of the sensation, but there's some research suggesting that it helps, and I'm on board to do what they have me doing, and just trying to get these even. Now you'll notice I have more extension on my right than my left. Active extension, that's as far as I get. If I relax, I can maybe get a little bit more if I do some passive extension, or even if I come up here. If I sit and relax into this and work on it, I can get a little bit more, but it's going to probably be a while before I have active extension on this side that's as good as the other. But bit at a time. So I think that's really all I needed to say in this part. So that gave the basic breakdown of things. I get fitted in 6 days. So I'm filming this on a Tuesday. So this coming Monday, I go back for my third follow-up visit with my surgeon. You're going to see the second follow-up visit in a little bit here. I have a clip of that, or a couple clips spliced together of that. I'm going for my third follow-up, and I should get fitted for my functional ACL brace at that point, which is what's going to allow me to start running and jumping. I can tolerate a little bit of a hop or a jog now, but really transitioning into that with that brace will be good. So I'll definitely provide some updates on that. I'll try to get more frequent with these updates again. And if there's any interest, I might actually put together a video showing progression of all the different exercises I've done, and kind of labeling them with roughly what weeks I was doing them in. But there we are. So I'm going to stop this piece here, and I'm going to splice in the other videos that I've got, and those will just be other clips that you can use, that you can see. And again, I'm going to label them with what, like roughly what week they were in. I logged the dates for them, so you can see basically when I was doing each one of those. But thanks for watching. And you should have seen in the description of the video also I'll have timestamps, so if you wanted to skip to any specific spot, you could just see that. But yeah, thanks for following along in this journey, such as it is. I'll keep posting updates. Soon enough, I'm hoping to start doing actual martial arts videos again, at least basic techniques and drills, as I start slowly preparing to transition back into that. So stay tuned for that. Thanks for watching and following this stuff, and watching as I get shaggier both up top and on my face. And yeah, that's all I got for you. So stay tuned for the remaining chunks of this video where I have some other clips there, and I'll catch you next time.
I haven't checked it. I hope you don't think it's weird, but I've been checking up on your progress via your videos.
Oh, no,
I've been
not at all.
Busy the past. Thank you for doing that. I mean, it's been a really nice thing for referred a few patients to it. And,
for sure,
like
for sure,
good.
absolutely.
So let's see what you got. Go and straighten it out for me.
Okay.
Good.
Yeah.
Excellent. So that's really good range of motion.
Mm-hmm.
Go ahead and relax for me. Good. So what I'm doing is I'm checking your passive range of motion now. If I'm able to get you here, that means you're eventually going to get there. Just what the problem here is that if you look at that quadriceps right here,
there's still a little
pretty shut down.
It's still not great.
Go ahead and try to tighten it. It's trying to wake up.
Yeah.
Good. All right, well, go ahead. And
That's probably been one of my biggest. That and just the sense of sort of like block in the joint.
Yeah.
Just because there's still fluid in there, I guess.
Go ahead and scoot forward a little bit towards me.
Yeah.
Go ahead and bend it back.
Okay.
Great. All right, good. Go ahead and lay back real quick. Let's have a feel of that wrap.
Alrighty.
Solid.
Awesome.
Can't argue with that.
Awesome.
Like compare it to your other
Yeah, for sure.
Good. Okay.
Yeah.
Good. Great. I mean, that's nice and solid. So.
Yeah, I remember when you first tested it.
Yeah, come on up.
I was about to jump off the table.
Yeah, so I think we
Did not feel good.
brought this in for you.
Yeah, last time it was. Yeah.
Talking about the video's not pulling up, so let me pull up my.
Okay.
So this may sound kind of weird, but I make for my particular surgeries, I like to make PowerPoints to kind of remind myself what to do.
Oh no, it's whatever works,
so
right?
this is So this is what it looks. So this is your big incision right here. So, and I know kind of you thought that perhaps it was an open procedure.
Yeah, I wasn't sure. Like I know, obviously, you harvested stuff from.
Yeah, so we harvest it right here, and then this is where your patella tendon comes from, and then we close that defect. You can see kind of we take that sliver off there, then close that defect, and then basically that's what it looks like when we close it. And then, so this is where we're doing it. So we have that area open, and we're putting the scope in through your previous incision, and that's where we're doing all the work. So you can see basically kind of how we're doing that right here. The scope's in there. We're performing a notchplasty, and then we put in the graft through that area right there.
Very cool.
So that's how we do it. Those are kind of just some stuff that kind of helps me kind of look at it before, kind of just go through the steps again in my mind before each procedure and go from there. So that's that. So good deal. So 6 weeks, kind of what are we looking for? So want to make sure that your range of motion is well on its way, which it is. Range of motion is fantastic. That last few degrees of extension, I can passively get you there. So that's that makes me feel good. That last when you're going to get those last few degrees is when your quad wakes up. And at the 6 week point, I don't expect it to be there, but it should be waking up here pretty soon. So, I follow you again up again here at 6 weeks from now. And if you're, I'll be kind of looking at you behind your back with PT, and if the quad kind of struggles a little bit, there's kind of some different adjuncts we can add to your treatment to help with that.
Sounds good.
But I think you're doing great.
Awesome. Yeah, and from a functional standpoint, it seems like everything's moving well. Like my ability to bear weight, the strength in general is coming back, even though I want some more action to happen over on this side. In terms of just getting through the day and being able to do my normal stuff, it's not. That hasn't been much of a problem. And in fact, that brace over there is gonna. Like, do I really still need this? Of course, I know why they're still kind of being cautious about it, but but everything feels good.
Confident you'll be able to ditch that here pretty soon.
I can get up and down stairs without anything. And I'm not like running stadiums or doing ladder drills or anything, but but it feels fine. Like it feels ready to accept the basic kind of stresses of just getting around and stuff.
And in terms of swelling, that's one thing that'd be fairly difficult to predict when that can go away. It can be around for several months, but as long as it's not increasing,
not at all,
getting red, getting more painful, then it's kind of just is what it is.
Yeah, everything continues to feel like it's progressing. Like as cranky as it'll get, if I have a heavy day where I work it really hard or where it's like just blocking me from getting a little bit of range, it's still, the trend line is going up. It's still moving in the right direction, I think.
Well, like I say, the way recovery is it's like this. So some days you're going to feel like you're up here. Some days you're going to feel like up here. But if you put an action in now, you feel like you're not, you feel something new that you're worried about. You're not where you want to be, just let us know.
Oh, yeah, for sure. And it's actually, I guess it's SOP also for you to do like the passive checks that you did. Yeah. But I was going to ask about that if you didn't, because I was like, it just, does it feel like it's intact? Does everything still feel good? Because I know, you check it right when you do the surgery, right? Right after the implantation, you're like, okay, let's make sure it's actually where it needs to be.
So what we do is, the particular thing that I look at is something called a pivot shift. You may have kind of come off that within your studies on this stuff, but it's one of the studies we do. It's basically that's been shown to correlate kind of the most with patient satisfaction and continued stability. It's hard to elicit that in a clinical exam, but you can usually get it when you're under anesthesia. So I always check that before the case, do the case, get everything nice in there, and make sure that the pivot shift has gone away.
Well, I haven't seen any indications that, from a stability standpoint as well as from a strength standpoint, there's anything really to worry about. There was stuff, I hadn't actually talked to you too much about this before. I'll be quick about it, but I used to be able to, if I would stand here, I could kind of, I guess, gap out my leg laterally. Just kind of do a varus stress here and open up the side, and my left would open up a lot more than my right, and I figured that was another artifact of the tear. Now I haven't been really pushing it, but it doesn't seem like it's doing that anymore.
That's the rotational stability aspect of it, and certainly that.
So like even that, and even though we're still way off from being fully recovered, quote unquote, like that has felt better too. Things feel like they're solid.
You're doing great. You're only 6 weeks out. This is something that takes about 9 months to recover from. So I know you're doing everything you possibly can, and you're doing well. So keep up the good work.
Trying to, without getting overzealous, right? Trying to kind of ride that line.
Yeah, I don't have to worry about you during your rehab. Some patients have to worry. I have to worry about you doing too much.
Yeah. It's but I know my tendencies and how I bounce back from or fail to bounce back from certain previous injuries and issues and all that. So I'm trying to be smart about it, and that's another reason why I'm doing the videos. It's actually you can see it, other people can see it. I can get called out if I'm doing something stupid.
Yeah.
So it's just another way.
Thank you for doing that.
No, I'm very, very happy to do it. And I was like, if one person can get some kind of tiny benefit from it, then it was worth the time.
Yeah, well, I've been sending people.
It gives me something to do.
They have a lot of questions. I'm like, well, he's going to take you kind of day by day, what you expect, and it's been, there's some things I can explain, but when someone goes through it, it kind of, that's really helpful.
Yeah, for sure. Well, I appreciate your input on this. I'm going to stop the video here, but very good stuff.
So this is a short arc quad variation. For a while I had a bolster under my leg, so I wasn't going through a very large range of motion earlier on. Especially with the blood flow restriction, my PT wanted to just keep the movement somewhat minimal, but I progressed out of this. So this is me just short of 7 weeks, and it was intense enough to start with. Anyway, it's called short arc simply because the arc I'm moving through is relatively short. So there you go. And now we've got the long arc quads. So as the name implies, I'm going through more range of motion here. This is a little bit more like a normal leg extension or knee extension exercise that you might see at the gym or that you might do just hanging off the edge of the table. Again, I'm using the blood flow restriction machine here. And so a lot of the exercises, the external intensity, if you will, or load is reduced because it's already being made harder with the blood flow restriction that we're doing. But we continue to progress things, and this is an example of that progress there. So you get to see just in 1 week, basically, this is sort of how we were moving along, and there's a comparison from one leg to the other there. And here we are with the total gym squats, such as they are. It's basically like you're squatting horizontally. There are some mechanical differences I won't go into, but it was really nice. These actually felt really good. I'm not doing blood flow restriction on these, though I have recently started doing one-legged ones with blood flow restriction. But here I am at about 8 weeks post-op. So again, you're seeing some of the progression there. And I took some of the sound out just because I don't want to get other people's information off to the side in the background. Here I am with terminal knee extensions. These were the same day. I have my brace on for this one since I'm weight bearing. These were really hard. Just lowering myself. The eccentric quad challenge there is pretty tricky. Trying to just do like a heel tap and then pushing back out. So I've done these a couple of times. They've always been pretty challenging. So you see me shaking like a leaf there with a little band pulling the back of my knee. So I'm trying to push into that and really work on my knee extension a whole lot. It's, like I said, tricky, but challenge is part of the game here when it comes to rehabbing these injuries and surgeries. And this last bit here is where I am at about 9 weeks post-op, or close to it, just doing a little warm-up. So you see the cycling is going well. Slowly my quad's coming back, but now I'm warming up, moving a little faster, and this is what I do for a few minutes before each session. And that's it. Thanks for watching.